share our experience, not only what individuals have done, but what teams have done right across the organisation, sharing the experiences and best practices. And we don't always get that opportunity to share those good practice initiatives.
We don't often in the NHS take time out to stop and pause and to celebrate. We know we've been on this journey, but actually we tend to, because we're so busy day to day, we just accept the improvements. So I think this has been a real opportunity for both staff, patients and our wider stakeholders to really stop and celebrate all of the initiatives and all of the huge progress that's been made.
Governance is so important because it's about having systems and processes in place, and it's about making sure we achieve quality standards of patient care to achieve excellent standards. We welcome you all attending the Governance Roadshow, which is really important today. It demonstrates why we're going to celebrate governance and the journey that we've travelled from an area of concern to now one that is heading towards excellence.
And it's very interesting timing for you at the moment. I think you've come out from under the cosh of the special measures and the regulatory arrangements. The shift now is to really clarify, what we as an organisation are about, what we're here to do. And it's actually not to just simply meet what regulators ask you to do. In practice, you've become yourselves the new regulators. To support that clarity of purpose, I think we also need two things, which is systems that work for us, not against us, not systems that you're filling in because somebody else needs you to do it, but systems that help you in the work that you do, and as a byproduct of that, feed the beast of the regulatory requirements. But increasingly those need to be joined up so that they're not in silos within the trust, or even more difficult, in relation to our partners that we work with outside of the trust. The real challenge to you is, having created a safe, successful working environment, now to extend that to working with your colleagues in other organisations, so that from the patient's point of view, there isn't just a narrow boundary around a little island, which is the trust, but actually as a whole health economy which is geared to supporting patients through whatever demands and requirements they need to make, as well as encouraging them to take better care of themselves in the future.
There were some very good pockets of governance going on both ends, but there was nothing in the middle, and we needed to make sure that we had a simple framework, a bridge if you like. The success has been that it is easy, it's simple, hasn't been easy to implement. The fear was that it was going to be lots more meetings, but actually in lots of places it's been less meetings, because these meetings were happening informally, they weren't structured, we weren't getting any output from the meetings, and that's now really clear. And we're getting assurance at all levels of the organisation, and what it means is we don't endlessly talk about this stuff, because we only report now by exception, so we know what good looks like. We measure it every month, and we really get to concentrate on the areas where we need to make improvements.
First report that I'm going to refer to is a CQC Section 48 report, and there was a particular quote in there that I want to share with you. There was little evidence of the whole trust working together to drive change and improvement in the care that was delivered to patients. Underpinning this, as found by other reviews, had been a lack of focus and clarity around governance systems and processes across the trust. It is worth mentioning that as part of the work that we've done, we've seen some huge improvements in things like patient relations and complaints and patient experience. We've made a huge investment in that particular area. Things like clinical audit are much improved. We've also done a lot of work in terms of our incident reporting and analysis. The Care Quality Commission re-inspection report, which came out in late 2015, and again, direct quotes, governance and risk management systems had improved considerably since our last inspection. A comprehensive risk management strategy was in place that set out the roles and responsibilities for risk. The appendices of the strategy gave clear guidance on undertaking risk assessment for inclusion on the risk register. Very recently, we've had several trust visitors going through similar experiences, and they're coming to us to learn from us. We're now seeing something as being at the head of the pack.
Do you know we have 700,000 patient attendances a year? No? 370,000 bed days used? Our local population is 360,000 people. That means on average, They come to visit us twice a year each. If we're treating 700,000 patients a year and we're getting only 500 serious complaints, I think that's a really good news story.
2 to 3 years ago, the department was, to say the least, in a bit of a pickle. Not many staff members were permanent staff. We had a huge backlog of complaints. So, for instance, in 2013, there were over 200 outstanding overdue complaints. I'd just like to introduce to you, at the back of the room, a couple of complainants who have come along to tell us their story in terms of how it was then and how it is now.
Hello, Ada. How are you doing? Gosh, lovely, whatever's the matter?
Oh, Ada, I'm so worried. You know, I've been in hospital the last few weeks.
Yeah.
Well, it's not getting any better and I don't know what's going on. Nobody will tell me anything. I'm so afraid that Frank's, I'm going to lose Frank.
Oh, honestly, Ada, I think you should just give pals another try. Honestly, I think they've changed for the better.
What we do have for the future is some complaint response feedback sessions set up with members of the public, and also some governors are going to attend as well.
The departments are going to move on to look at their safety culture within the area in order to develop an understanding of the basics of safety culture theory and the impact that that has on safety within their department.
I'm at the hospital. Jean's had a fall. She's still unconscious.
I've been dreading this appointment.
I hope Steve can remember me today.
6 a.m. this morning. Yeah, he's £8.
I'm sorry, Mrs. Benson. There were complications with your husband's surgery.
In my mind, this perfectly summarises the NHS today. I think the horse represents the staff working in the NHS, completely rushed off their feet, literally. The boxes represent the stuff that weighs us down, be it our regulators, constitutional standards, the difficulties of delivering challenging financial targets, and a population who it seems are becoming more and more dependent on our services. All the horse wants is to get its feet back on the ground and to do the job it's geared up to do. But to enable that to happen, it needs to be relieved of some of its load, so that when the load becomes manageable, progress will be made. I just need to share with you that I heard about your Patient Safety Summit before I ever set foot in your trust. And some folks from GGI said to me, you know, this is what they're doing in Morecambe Bay and it's brilliant. And I got quite a lot of written information about it. The trust I was working in London, we embedded Patient Safety Summit down there. So it's slightly different, it works in a slightly different way, but you almost need to get it branded because it's brilliant and it works. And it's a really positive way of discussing incidents and near misses.
The Health and Safety Executive came in about 3 years ago and they found us seriously wanting in our health and safety management system, but also in our governance systems generally. When the Health and Safety Executive came back in, they said to us that they were absolutely amazed, not only at the speed that we'd achieved what they needed us to achieve, but also how well we'd done it.
From 2013, our clinical audit plan, we only delivered on 58% of our clinical audits. That was agreed at that time. Moving on to 2014, we had an increase to 83%.
As we all know, patients presenting as emergency are the sickest of the patients, and yet these patients receive variable care and variable standards of treatment all throughout the NHS hospitals in the country. TPOC, which is the trial to try and help improve this care, was voluntary, and we volunteered, our trust volunteered for it. So Lancaster is also part of this, and there's only 92 hospitals in the country that participated in this trial.
The frontline staff, how accessible and how useful is the library to them? That's really key, really, because that's where a lot of this is going to be used, and that's where you want them to be able to say, yes, I know exactly where that is, it's there. And that's all you want. It's very simple. And I think that's the important thing about the library. It's very clear, it's very obvious. If you want it, there it is.
We didn't want to be part of something that was failing, so we took stock, and what we did over a period of time, we slimmed down the programme. We went from 40 to 12 projects, and what that meant was that we could actually work far more closely with the people delivering the projects. We could add value, we could support them, we could advise them. So we have a part of that process called Sustain and Review, and what we just do is we continue to track a number of key performance indicators during that period, make sure that those improvements that have been made are embedded and they are sustained beyond the life of the project.
When I was thinking about what we need to do with this organisation, I thought about capture, reflect, improve, evaluate and share. But if you think about what those letters actually mean pulling together, it's fair to say there's been a lot of that around, because I think it's fair to say it's been quite hard, and CRIES at some point was very, very useful acronym. We've actually done something different, something innovative. And I think it's important for everybody who's contributed to the bulletins and the learning lessons that we have really gone a long way and done a really good job to get it to this point.
And what I'm about to share with you is some statistics that should show what a significant undertaking the Trust is.
All be very proud. Every single member of staff in the whole of the organisation, and working with our partners, we wouldn't be here today being able to celebrate that success.
It's important for people who run the NHS to know what the problems are, and it's the people like us who are ordinary people. We're nobody special, but it's for people like us to let them know what's wrong.
Being the human factors lead, I think that there were very important messages going forward, that we need to work together collaboratively, and we need to identify issues and work towards them. We need to learn from the incidents and improve our organisation practices. So it was fantastic.
I've seen an attitude and an enthusiasm for things that other trusts sometimes are struggling with. And here we're embracing it, it's becoming part of our culture, and you can see the enthusiasm that everybody has.
We've utilised the artist because the artist on every single presentation has been able to draw on paper our experiences for the day, and has demonstrated on paper our improvement journey.
This is important enough to actually take time out and to celebrate, so that's a really important message and a powerful endorsement of how hard staff have worked in the last few years to get us to this point.
The event has gone extremely well, and people have been very positive and commented on the improvement journey that we've made over the last 2 years across the organisation.